And now we're going to talk briefly about MISC, Multisystem Inflammatory Syndrome in children. So this term was kind of established after the pandemic because pediatricians, doctors started to see kids that were diagnosed with COVID presenting with some kind of Kawasaki-like pictures, right? So we know that Kawasaki, you have at least 5 days of fever, you have multi-organ involvement, many signs of inflammations. So similar to Kawasaki, and then doctors found out, okay, this actually, we should categorize this kind of presentations as MISC. And there's also multisystem inflammatory syndrome in adults, the MISC-A, but today we're just gonna focus on children, MISC. So it is a severe inflammatory syndrome occurring usually 2 to 6 weeks after your diagnosis of COVID. Most people had it around week 4. And the incidence so far is about 1 in approximately 3,000 to 4,000 of infections in children. It's a pretty severe complication because those kids that have MISC, 60 to 70% need to be in the ICU, intensive care unit, and 1 to 2% of them die. So this is much higher mortality rate compared to just the regular COVID that when we were talking about earlier. And then you look at the picture, the graph on the left. This is about the race and ethnicity of those kids that were diagnosed with MISC. And the majority of MISC patients have been of Hispanic, Latino, or non-Hispanic Black race ethnicity. So these two populations, since the pandemic, have also been disproportionately affected by COVID-19 as well. And then on the right here, the age group. So the age that the most kids that have MISC are ranging between 5 to 11 years of age, as you can see here. So what are the common symptoms of MISC? Like I mentioned, it's kind of similar to Kawasaki, but we use that the fever only has to be 3 days, at least 3 days though. And then there will be lab evidence of inflammation. So we know that the inflammation markers, inflammatory markers like ESR, right, CRP, ferritin, those are inflammatory markers. And there has to be, multi-system involvement, more than 2 organ involvement. So it could be GI, it could be respiratory, it could be your eyes, and maybe some neurological symptom involvement. And there has to be no other alternative plausible causes, and then there has to be a positive COVID test result or exposure to COVID the weeks prior. And so we're not going to go into too much of a detail of the treatment, but kids that have MISC, they should be admitted to the hospital, and it's best to be at a tertiary center where there's a PICU. Reason being that these kids, like we mentioned, about 60 to 70% of them need to be in the ICU, and they can deteriorate pretty quickly. Some multi-specialty involvement is very important, especially cardiology. So similar to Kawasaki, we know that Kawasaki, you may have the coronary artery aneurysm, right? So in MISC, there can also be myocardial, the muscle involvement. There can also be the coronary artery aneurysm. And that's why cardiology is almost always consulted when there's a patient with MISC. The other specialty that's often consulted is rheumatology, because MISC, similar to Kawasaki, it's inflammation in many sites of your body, including your blood vessels. So that's why rheumatology is almost always involved as well. The treatment for MISC is like Kawasaki, the IVIG infusion, and some kids that were more severe might need steroid. And then after they are discharged, if there's no contraindication, the kids should be on aspirin as outpatient treatment. And proper follow-up is very important. The proper follow-up including, routine visits to cardiology to kind of examine the heart, checking if there's any possible complications. And just a quick numbers. Currently, after 2 years of pandemic, there is about 6,800 kids with MISC in the United States, and 59 of them died, unfortunately. And actually males it happened more in males. So 60% of patients of MISC is male. So since we were talking about MISC, I'm gonna talk about vaccination and MISC. So this study came out just last month in January from the CDC weekly report. And it's a really good source. So if you guys are interested, there's always some paper every week published on CDC MMWR. And it's always up-to-date study regarding COVID. That could be vaccines, could be, different kind of study just about COVID, and it can be kids or adults. So this was published last month. And you look at the 24 children's hospital in the United States, mainly to look at the effectiveness of vaccination in MISC. So the study period was between July 1st until December 9th last year. And they collected the patients that were admitted due to MISC and between age 12 and 18 years. And there's also a test negative group because the case group was the kids that had MISC, right? And there's test negative group. So test negative group would be kids that did not have COVID or did not have any symptoms of COVID. So the study found that in case groups, so those kids that were admitted due to MISC, 95% of them were not vaccinated. Okay, so, and this is only looking at 12 to 18 years of age. So in this age group, only the Pfizer vaccine is available. So this study mainly talk about Pfizer vaccine. And in those kids that were admitted to the hospital due to MISC, 39% of them needed life support. What kind of life support? Intubation or vasoactive infusions or even ECMO. And there's still some kids that were admitted to the hospital due to MISC that were actually vaccinated. But those kids that were vaccinated and admitted due to MISC, they did not need any life support. So the conclusion of the study, so vaccine effectiveness against MISC after 2 doses of the Pfizer vaccine is actually 91%. So we know that, vaccines do protect you from, not just severe COVID, but also prevent you from getting MISC or needing life support after you're admitted to the ICU.